A commonly used steroid may be the key to treating seriously ill COVID-19 patients. It's called dexamethasone. It's been around for a long time. It's cheap and widely available. Now, researchers in the United Kingdom say it could be a breakthrough in treating some patients with COVID-19.
Researchers at Oxford University are calling it a breakthrough. They say in their recent trial, dexamethasone, a drug typically used to treat certain forms of arthritis, severe allergies, and asthma, reduced the risk of death among hospitalized patients with COVID-19 requiring ventilation by a third.
It's promising. It's the first study that's actually shown a mortality benefit, which is really exciting. It's a commonly available drug that's already been approved and is used for a lot of other conditions. So it's not something that people are going to have to jump through a lot of hoops to get.
2,100 patients received a low dose of the drug for 10 days, a drug that costs as little as $8. Bay State Medical Center infectious disease Dr. Megan Gallagher says it shows promise for the sickest of sick COVID-19 patients.
It's important to remember that the best benefits were seen in people who were intubated, who were on ventilators, where we saw a 35% reduction in mortality. The next best group was the ones who were on supplemental oxygen, where we saw a 20% reduction in mortality.
Dr. Gallagher tells Western Mass News the findings do not mean people should start taking it at home.
Dexamethasone is a steroid. It's an anti-inflammatory, so it's tamping down the body's immune system response. So taking this is not going to prevent you from getting COVID.
While the findings are preliminary, lead researchers say it should become a standard of care in the UK for COVID-19 patients requiring either oxygen or ventilation.
Now, researchers say it showed no effect in patients not on oxygen or a ventilator, and it did not include patients outside of a hospital.